Good afternoon, everyone. My name is Kim Bittner, and I'm with the ESRD National Coordinating Center. Thank you for joining us today for the ESRD NCC Patient Education Quickenar. This ESRD NCC Quickenar event is held in partnership with the Centers for Medicare and Medicaid Services. We are hosting these 30-minute events weekly. They feature patient and professional subject matter experts from around the country sharing how they or their organization are coping with situations related to COVID-19. Before we get started, I wanted to let you know that this call is being recorded and will be posted on the NCC COVID Quickenar webpage, usually within 72 hours. Let's take a look at the agenda for today's call. Today we have two speakers. First, Dr. Shannon Novosad from the Centers for Disease Control and Prevention. Also joining us is Stephanie Booth, also with the CDC. Today, they will discuss COVID-19 and methods for stopping the spread of the germs and protecting yourself. This topic is increasingly important as states continue to open, while there's concerns about how to remain vigilant with personal prevention measures. As our speakers go through their presentation and you have questions, please submit them using the chat feature through WebEx or the Q&A on the lower right of your screen. When we get to the question and answer section of this presentation, we will share the questions we have received with our speakers. Our goal is to answer as many questions as time allows. And please do use that chat or the Q&A feature to go ahead and record your questions, because we're going to go ahead and monitor those throughout the presentation. So what's this call all about? These Quickenar events give you an opportunity to hear tips for coping in a COVID-19 environment, learn about real-world experiences that you'll be able to put to use, and engage with these calls on a weekly basis on varying topics. So we do invite you to join us here weekly, and we look forward to having you on these calls. Now let's introduce today's speakers. First, Dr. Shannon Novosad is a medical officer on the dialysis safety team in the Division of Healthcare Quality Promotion at the CDC. In 2015, Dr. Novosad came to the CDC as an Epidemic Intelligence Service Officer assigned to the Division of Healthcare Quality Promotion, where she investigated outbreaks in healthcare settings. Her areas of concentration include prevention of central line-associated bloodstream infections and increasing safety of patients on dialysis. Stephanie Booth is the infection prevention educator for the Making Dialysis Safer for Patients Coalition. She has a degree in healthcare administration, a certification in infection control, and is contracted by Northrop Grumman in the Division of Healthcare Quality Promotion at the CDC. Stephanie expertise relies on her more than 15 years experience in the dialysis setting as a certified tech, biomedical tech, clinical coordinator, and educator. Thank you, Dr. Novosad and Stephanie. We'd like to welcome you both today, Dr. Novosad and Stephanie, to the call. And Stephanie, I believe you're going to get us started with the presentation.
Yes, thank you so much. And thank you to the NCC for inviting us to participate in these Quickenar series. I'd like to start today's presentation by emphasizing that today I'm going to be presenting information that most of you probably already know or have learned about COVID-19 in the last few months, but it is important for us to remain diligent. We need to continue to follow recommendations to protect ourselves, reduce the risk of getting COVID-19, as well as protecting others as we move forward and states start to reopen. Next slide, please. So let's get started with our review by discussing how COVID-19 spreads. COVID-19 spreads mainly among people who are in close contact with one another within about 6 feet apart for a prolonged period of time. The spread happens when an infected person coughs or sneezes or talks, and droplets from their mouth or nose are launched into the air and land in the mouths or noses of the people nearby. The droplets can also be inhaled into the lungs of people nearby. Another way the virus is spread is through contact with contaminated surfaces or objects. It may be possible that a person can get COVID-19 by touching a surface or an object that has the virus on it and then touching their mouth, nose, or possibly eyes. However, this is not thought to be the main way that the virus spreads. Please keep in mind that COVID-19 is still a new disease and we are learning how it spreads. CDC is constantly monitoring the science and updating recommendations to prevent the spread of COVID-19 to keep everybody safe. Next slide, please. So let's take a minute to review COVID-19 symptoms as well. Symptoms of COVID-19 typically appear 2 to 14 days after exposure and can range from mild to severe illness. The symptoms include cough, fever, chills, muscle pain, shortness of breath, difficulty breathing, sore throat, or a new loss of taste or smell as shown here. However, this is not a list of all possible symptoms associated with COVID-19. You should never hesitate to call your medical provider or dialysis clinic for any symptoms that concern you, not just the ones listed here. Your dialysis facility should be asking you about symptoms each time you come to dialysis before entering the treatment area. In the next few slides, I have things to review, some everyday things that you can do to protect yourself. Next slide. So let's remember to wash our hands with soap and water for at least 20 seconds, especially after you've been in a public place or after blowing your nose or coughing or sneezing. Some other times it's important to wash your hands could be before eating or after preparing food, after using the restroom, before putting on, after taking off, or after touching your cloth face covering, or before and after your dialysis treatments, just to name a few. If soap and water are not readily available, you should be able to use hand sanitizer that contains at least 60% alcohol. Make sure to cover all surfaces of your hands with the sanitizer and then rub them together until they feel dry. And also try to avoid touching your eyes, nose, and mouth with unwashed hands. Next slide, please. Social distancing, also called physical distancing, means keeping space between yourself and other people outside of your home. To practice social distancing, you need to stay at least 6 feet, which is about 2 arms length apart from other people. Keeping the space between you and others is one of the best tools we have to avoid being exposed to this virus and slowing its spread locally, across the country, and around the world. Dialysis facilities will try to maintain social distancing practices as much as possible. For example, think about the waiting room at your dialysis facility. When you are waiting to be called back for your treatment, you should try to stay at least 6 feet away from others that are waiting as well. In addition to social distancing, everyone should wear a cloth face cover in public settings and when around people who don't live in their household, especially when other social distancing measures are difficult to maintain. So in the next few slides, I'm going to explore this just a little bit closer. Next slide, please. So let's talk about source control. One of the ways CDC recommends to decrease spread is through everyone practicing source control. This is called source control because the face mask prevents germs from your mouth and nose, which is a potential source of COVID-19, from spreading to other people when you talk, cough, or sneeze. Source control, in addition to the social distancing I discussed in the previous slide, is essential to prevent the spread of germs and protect others. CDC recommends that everyone over the age of 2 wear a cloth face covering in public or within 6 feet of another individual to prevent spreading the germs that cause COVID-19. Everyone in a dialysis facility, including patients, visitors, and staff, should be practicing source control. Patients should wear a cloth face covering every time they leave their house and for their entire dialysis treatment. Dialysis facilities will help you maintain source control and social distancing practices. And when providing your dialysis care, you will notice staff wearing personal protective equipment, cleaning their hands, and disinfecting surfaces and equipment frequently to decrease the risk of infection. Next slide, please. Since we talked about source control, let's dive a little deeper into how to correctly wear and care for your cloth face covering. Be sure to wash your hands either with soap and water or an alcohol-based hand sanitizer before you put on your face covering. Make sure that the face covering completely covers your nose and mouth and it is secure under your chin. And also make sure the sides fit snugly against your face and that you can breathe easily. Next slide. As a reminder, you are using the cloth face covering to protect others in case you are infected but don't have symptoms. You'll want to wear your cloth face covering every time you leave your house or are in public settings or around any people that are not part of your household. In addition, it's especially important to remember to wear your face covering when social distancing measures are difficult to maintain. And of course, remember to wear the face covering correctly, as we just talked about. Wash your hands prior to putting the covering on. Make sure it fits properly, covering your nose and mouth. And wash your hands if you accidentally touch the face covering. And if you need to remove the face covering briefly, you don't want to push it down around your neck or up on your forehead. So let's talk a little more about that. Next slide. You want to make sure that when you remove your face covering, you do it carefully each and every time. Although this slide says when you are at home, this can apply to any time you remove your covering, such as prior to eating or drinking, or in your car, in your dialysis clinic, or at home. To remove the face covering safely, you need to untie the strings behind your head or stretch and grab it by the ear loops. Be sure to handle it only by the ear loops or these ties when removing, and then fold the corners together. Place the covering in the washing machine, or you could hand wash your face mask using hot soapy water. If you're hand washing, make sure to scrub the mask for at least 20 seconds, and then the fabric face mask can be dried in the dryer on high heat. Remember, do not try to wash the disposable surgical masks that you may get at the hospital or dialysis clinic. Throw them away when visibly soiled, damaged, or if it's difficult to breathe. Next slide, please. As stated previously, CDC recommends all people 2 years of age and older wear a cloth face covering in public settings and when around people who don't live in their household, especially when other social distancing measures are difficult to maintain. Some states have implemented mandatory mask laws or guidances as well. These states may have even broken down these regulations into smaller regions, areas, or counties, and they can even be specific to locations or businesses, such as public transport, or specific businesses such as restaurants or beauty salons. It's important to know what has been implemented in your state or region, but the most important thing to remember is even if your state is not requiring the use of masks, wearing a face mask will help keep you and others safe. Next slide, please. The CDC is constantly monitoring the science and updating recommendations to prevent the spread of COVID-19. And as states begin reopening, we all still need to remember some other basic precautions and be vigilant to implement them and prevent the spread. The first is to remember to cover your coughs or sneezes by using a tissue or the inside of an elbow. And also remember to clean and disinfect frequently used items and frequently touched surfaces as much as possible. If you really think about this, think about some items in your home or other places, such as light switches or door handles or cell phones or any other items that you might touch rather frequently. Also, monitor your own health by closely watching for COVID-19 symptoms. And be sure to contact your care team if you begin to feel ill or if you have concerns about any symptoms you may be experiencing, even if it's not on that list of symptoms we previously discussed. And of course, be sure to stay informed about the latest COVID-19 news. Some states have websites, email updates, or emergency alert systems that can provide you with the latest information. Next slide, please. There are many dialysis-specific resources available on the CDC COVID-19 website that you can use to stay informed as well. There are 2 fact sheets pictured here titled How Our Facility is Keeping Patients Safe from COVID-19 and Coronavirus Disease 2019, Keeping Patients on Dialysis Safe. They're both informational handouts that were created for facilities to share with patients and caregivers to explain how they're preparing for COVID-19 and what precautions patients and caregivers can take during their daily activities and their dialysis treatments to stay safe. Next slide, please. And remember, it's okay to speak up and have conversations about infection prevention. Don't be afraid to use your voice. You are the most important member of the dialysis team, and it's okay to ask staff questions about the measures they're taking to keep you and other patients safe. I know this is not easy for everyone, so some example questions to get you started may include, what is the clinic doing to prepare for COVID-19? How will these changes affect my treatment? What can I do to protect myself and others? Or simply, do you mind cleaning your hands again before you care for me? The CDC has a couple of newer resources created to address the topic of speaking up in dialysis. The first is a video that's shown here on the importance of speaking up, and the second is a tip sheet, also shown here, for staff to accompany the video. Patients on dialysis, caregivers, and dialysis staff are all encouraged to watch and share these videos and use the staff tip sheet to create a culture where everyone feels comfortable speaking up and having conversations about infections in dialysis. And this definitely includes conversations about COVID-19. Next slide. Oh, so thank you so much for your attention. I think now we have time for some questions and answers, but I'll turn it back over to you. And thanks again for your time and attention.
Thank you so much, Stephanie. We actually have received a few questions. Matt McDonough, I'm going to be handling the Q&As that have come in. And before we do jump into those, we do want to invite any of our attendees, if you have a question that you would like answered, please don't hesitate to submit those via the chat panel or the Q&A panel. We've received about a half dozen or so thus far. So we'll just jump right into those. And this first one, patient asks, they know that most people who get COVID-19 recover. Is that statement being observed as being true for dialysis patients as well?
Hi, this is Shannon. Yes, so I think that statement is still true for dialysis patients, that, the majority of people who get COVID-19 recover, but I think it's important to caveat that a little bit, in that we know that dialysis patients are still at a higher risk of having severe illness with COVID-19. So that means compared to, a person, a general person walking around who might not have any, medical problems, they are more likely to get, sicker with COVID-19, meaning they may have to get admitted to the hospital, they may have to stay in the hospital for a longer period of time, and they may, die at a higher rate than other people. I don't want to say that in any way to be alarming, though, because, again, most people are still going to recover after COVID-19, but it does mean, we say these things on the things that Stephanie was talking about. We think they're things that everybody needs to do, but in particular, as patients on dialysis, it's really important that you adhere to these, just due to that, higher risk of getting more severely sick with COVID-19.
Mm-hmm. That's a great answer. Thank you. That risk should absolutely continually be considered. Question just came in, and this is related to staff and treating of patients. This person hears that from patients that technicians who are treating persons under investigation in isolation wards are also treating non-PUI patients during that treatment. I think the question that was asked was, can a person be contagious even if they don't show signs of COVID? And obviously that answer was yes, you can be asymptomatic. But in terms of treating PUI and non-PUI patients, is there a recommendation from the CDC on how staff should handle that?
So I think, in an ideal situation, staff would be able to be separated, taking care of only patients with COVID and patients without COVID. But we know that that is not a situation that is able to happen everywhere, and it really depends on staffing levels at the facility and how many patients may be present. So if, staff are not able to kind of separate by the types of patients that they're taking care of, we do think it's really important, though, that staff are adhering to all of the infection control recommendations. So, doing all of the hand hygiene that they need to do, changing PPE as needed between patients. And so I think the risk of staff transferring between patients should be greatly minimized if staff are able to adhere to all those recommendations. So again, I think it goes back to something Stephanie was saying. If you're concerned about something that you're seeing in your dialysis facility, I would definitely encourage you to speak up and ask, like, why are they doing it this way, or if they're doing it this way for a specific reason, kind of ask about what precautions they're taking in between patients to make sure everyone stays safe. I don't know, Stephanie, if you had anything else to add.
No, I think you covered it all. I do think that it is very facility specific. And like you said, Shannon, if the facility doesn't have the staff or the mechanism to dialyze them separately, it can be done safely, but it really will depend on that facility.
Right. Another question that came in it's somewhat related to that is, and we're going to assume a worst case scenario here is, if someone's dialyzing at a facility and a patient in that facility, not the person asking the question, but a patient contracts COVID in the center, what are the recommended things that the patient should do, one, to protect themselves, and any staff recommendations as well?
So just to clarify, just somebody in general might have COVID-19 in your clinic? That's what's being asked? Yeah,
the person asked if they're dialyzing in their clinic and a patient that they dialyze with has COVID. What are the things that they should do at that point, knowing that they've been in a dialysis unit with somebody who's been infected?
So I'll start, and then Shannon, maybe you can chime in as well. I think that this kind of goes back to that last question, that there are things that the staff should be doing PPE-wise and washing their hands often and things like that to help keep everybody safe. And I think implementing those as soon as that would be heard. I'm kind of imagining that we're talking about somebody is diagnosed with COVID while they're on the dialysis machine. I think that by doing that, the staff can help keep everybody safe. And kind of those everyday things that I talked about in some of those slides, the wearing the face coverings and things like that. I hope that you're not within 6 feet of the next patient. And I think that social distancing happens just naturally in dialysis clinics between stations. So I think that, keeping safe, following all the recommendations, I think that truly is the answer. And I know that sounds kind of like a canned answer, but I think that really is how we keep everyone safe.
Yeah, no, I agree. I think it kind of starts even before, someone in the facility may, get diagnosed with COVID. I think it goes back to these basic practices that we all need to be doing all the time. And I know that you've been hearing about them for several months now, and it definitely can feel old or start to feel like maybe we don't need to do this anymore. But I think if we're all still adhering to all of these basic principles, like the social distancing and the hand washing and the wearing the masks, that the risk of you getting COVID from someone else in the dialysis facility is going to be very low at that point, because everyone was already doing the right thing. So that's why it's so important to, even if there's no COVID cases in your dialysis facility right now, I think it's why it's so important to still be doing all of these things, because, we don't know. Transmission is still happening widely in a lot of places, and we never know when someone's going to end up being positive in the dialysis center. So that's why we don't really want to let our guard down right now, and really want to kind of all work together to keep each other safe. And then, but I think, once you've learned that someone has it, it's still really doing those same things, but just, staying extra vigilant in terms of monitoring your symptoms and stuff, and, letting the dialysis center and your healthcare providers know, if you start to experience anything that you're concerned could be COVID.
Wonderful. Thank you so much for that very crystal clear answer. Appreciate that. Got about 3 more questions that have come in. Do you have any special or unique precautions that transplant patients should take, or this general, vigilant guidance to continually wash your hands and social distance, is that enough for them?
Yeah, I think in general it's still the same precautions that are going to be recommended for everyone. There's not, a special set of recommendations just for transplant patients or just for this group. I think the caveat is that, anyone who is, pretty immunosuppressed just needs to be even more cautious than I would say the average person. I don't want to imply that the average person doesn't need to be cautious,
right.
But I think, making sure that you kind of have all of these extra plans in place to know what you can do safely. So I think just kind of thinking through the extra steps in terms of, are you able to go to the grocery store? Are you able to do this kind of stuff? Are you able to kind of have supplies of your medicine? So it's not necessarily extra steps in terms of the basics like the hand washing, the masks and stuff. I think all of that's still the same, but I think it's the extra planning that just to make sure that kind of all of your ducks are in a row in terms of having all of the stuff you need for medical stuff.
Sure. Thank you. The next two questions they're kind of similar in nature, and I think the individuals that are asking these are looking for guidance on how they can address this situation themselves and then perhaps with their staff. This one was, there are a few patients in my center who wear their masks with their noses uncovered. Obviously, not CDC guidance. Sometimes they comply when asked to fix it, and sometimes they pull it down when staff's not looking. Can you re-clarify the proper way to wear the mask? And then if you have any suggestions to help that person to potentially address that.
Yeah, so you're correct. The mask should be worn over the nose and the mouth, and it should actually go and tuck under the chin. So, and also the sides need to be tight to the sides of the face, and that's the proper way to wear the mask. For the other part of the question of how to talk to somebody who refuses to wear their mask in that way, or if they're pulling it down, I think that sometimes the lack of knowledge of understanding why we're wearing masks is important to point out. I think, that one slide where I said, the reason we're wearing masks is to protect those around us. And I think sometimes people don't understand that. And, just like anybody, I feel like I would like to protect the people around me as much as I want to protect myself. And so that sense of responsibility, understanding that kind of changes what, if I were a dialysis patient or even as a dialysis staff, I guess that kind of changed it for me when I heard that. So I guess you could share that information with somebody. Otherwise, it looks like I'm looking in the chat box and it looks like I can see this question and it says that they've already talked to the staff. So that would have been my other thing, would be to talk to the staff. And see if they can address it in any way. Another thing, though, is beyond just the staff, like the techs and the nurses, you guys have a great resource in your social workers. And, sometimes the social worker can actually sit down and maybe she could talk to the patients that are doing this and maybe explain kind of that reasoning as to why it's so important. And maybe that could be another avenue.
I think that's a great suggestion. I think communication, obviously, we want to focus on, and don't stop, as your last slide said, don't stop asking the questions that are important to you for your care, and ensure that people know that you're not comfortable with that. So,
yeah, the other thought I had, sorry, guys, I was just going to say too, maybe, I don't know, maybe even depending on who the person is or the comfort level. I mean, it could be asking the person, why they don't have their nose covered. Maybe and then that might be kind of an opening to provide them more education or to delve deeper, and maybe there's some particular issue or something going on, and then, could help engage staff or social workers or others in helping address it too. So I think just keeping the conversation open as much as possible is probably the best bet.
Absolutely. I know we're coming up at our time. One last question that I think is a good one, because there's a lot of confusion that I've heard on this. Can people bring COVID-19 into their houses with their shoes? Should they take off their shoes at the door?
I don't think that there has been any evidence of any transmission occurring that way. And so if you, read through, for example, the recommended PPE for healthcare personnel, it doesn't, have any information on there that it needs to be done that way, that shoe covers necessarily need to be worn. So, however, I don't think it is, a bad idea just to take your shoes off as you come in, kind of leave them at the door. But I don't think that there's any, particular, information that, cleaning the shoes or doing anything like that, prevents transmission of COVID. And I, again, could potentially, I think, just kind of contaminate things more. So I think, yeah, it could be good practice just to take them off, but I don't think, we have any evidence that it's being, transmitted that way or anything.
Fair enough. Well, thank you both for answering these questions and taking the time to be with us today. We did receive quite a few questions there at the end, and I hope those, if you didn't have your question answered, it was answered indirectly through some other questions that were asked. So Shannon and Stephanie, thank you again so much. We appreciate having you on today.
Thank you.
Great, thanks.
All right, let's go ahead and move into our wrap-up. We want to talk about the kidneyhub.org. As you may have heard, it is a secure and mobile-friendly web tool for patients and professionals developed by patient subject matter experts with the ESRD NCC. And the resources that are available on this tool were what was expressed as being important to patients, such as infection prevention, as we're talking about today, COVID-19, transplant, etc. So we invite you to go out to the kidneyhub.org, take a look around, bookmark it to your smart device's home screen. That could be your iPad, your tablet, your smartphone, and take a look around and let us know what you think and what you'd like to see out there as well. Our next COVID-19 Quick&R events will be tomorrow. We'll have our provider-focused event that is at 5 p.m. Eastern Time. And our next patient-focused event will be 1 week from today, July 14th at 5 p.m. Eastern. Those events are out for registration on www.kidneycovidinfocenter.com. So if you'd like to head out there, take a look at those events, and we would certainly love to see you on an upcoming provider or patient-focused event. So on behalf of the ESRD NCC, I want to thank our guests for being with us today again, and thank all of you for taking some time out of your afternoon to join us. We hope that you found today's session informative. We always hope that you learned something new. And most importantly, we hope to see you back safe and healthy on a future Quick&R event. Have a wonderful afternoon.